Good evening. This is Dr. Thomas Klein. I'm coming to you from Raleigh, North Carolina. I am a specialist in people with rare painful diseases who require treatments with opiate pain medications. Now, something very nasty is starting to happen with our PDMPs. Now, that's a national term. It means Prescription Drug Monitoring Program. Now, when they had people in Florida running pill mills, people were going from doctor to doctor. So it was important to have a computerized program that would catch criminals who are selling drugs, who are going from doctor to doctor. Now, what's the problem with that is that they are distributing drugs illegally and making a lot of money and not paying any taxes. This PDMP was originally set up at Brandeis University in order to help doctors identify patients who were getting prescriptions from multiple doctors. The problem is that it turns out of all the prescriptions, this is how many people actually get fraudulent prescriptions. 1%. 99% of people have regular prescriptions. So we're hunting down all of these to catch one person. So that's what these programs do. It wasn't for doctors, it was for the police department. Now, they have these scores that are now being applied to all of you patients. Then you don't know it. They're called overdose scores. A company called APPRISS, APPRISS, is selling software for millions of dollars a year to legislators who think they're fighting the opioid epidemic. But they're not. They're invading your privacy. So anybody in a doctor's office, can look you up and look their neighbors up. Oh, look, the neighbor's on opioids. Oh, look, my sister-in-law's on opioids and didn't tell us. So it's kind of the new way of identifying witches. People who take opiates are witches because they'll infect you or your neighbors with all this bad stuff. Now, I was horrified to find out when we were signing into the PDMP program here in North Carolina, which is just called the PDMP. Other places it has other names. That there was a report in there on me as a doctor. And here's a picture of the report. They don't send it out. They didn't notify me they were doing this. Here's a report on me and my bad prescribing habits. Of course, all of my patients before they were taken away from me, as you know, were people with serious, permanent, painful diseases. But the only treatment for them is long-term high-dose medication. Now, high dose, as we've talked before, is a non sequitur. There's no such thing as high dose according to the FDA. This is a medicine you give until it works. It doesn't matter what the milligrams are. That's a myth that we can't get rid of. For example, over here, and my cameraman will zoom in on that where my finger is the MME per day. Now remember, MME is the same as like milligrams. So in other words, I'm giving over 1,000 milligrams a day. Oh my God. Get rid of him. This was one of the concerns of the North Carolina Medical Board. Over 1,000 milligrams. But there is no over the 1,000 milligram cutoff anywhere. This is an odd drug. You can give as much as you need. It's very much like insulin. You give as much as you need. You don't worry about the units of insulin. You just give it until it works. That's the same way with this medication. But you see, the implication is by preparing this report on me without my permission, they've taken my medical practice and made it look bad. 1,000 milligrams, oh my heavens. And then down here we have sedatives. Oh dear, sedatives, that would be benzodiazepines. And then here's a good one. Patients at risk They are doing a medical report on me as a practicing physician saying that I am putting my patients at risk by giving them both benzodiazepines and opiates at the same time. Now, we're going to have a separate session and we're going to talk about the dishonest, very dishonest medical reports that determine this. Actually, there is no report that shows that benzodiazepines and opiates are dangerous other than the FDA warning. Remember, there's 600 drugs with warnings. Be careful, they said. You know, be careful when you not stop them. So here is my report. So if some police person, DEA or board pick this up, you better get Klein off the streets. He's dangerous. Problem is, all of these criteria are invalid. Now, we're going to talk more about this stuff later on, but I think it's very important that you start asking your state legislators, is there a program, and they're in all states, that tracks prescriptions? Now, it may have a different name, and ask if you can see yours. See what they tell you. And you know what it is? Of course you can see yours, where you have to file a report in writing, and then maybe a month later it'll come back. But as doctors or people working in my office can just plug in the numbers and get all this information, including this, in 2 seconds. So if they want to check me out as a doctor, look at this. This is a horrible report. So it looks like we're going to have to get some lawsuits going. You can't have an agency rating doctors based on numbers, and numbers that are not true. So please check your state, because it's got your information on there and my information. And what's going on? Why is this being done? This is the new way to go after doctors and patients, not with facts, with suspicion. You see, these are indicators of suspicion. And that's how we're doing things with all the dope fiends out there taking these pain medicines. And what's behind it all? Fear of addiction, phobia. This kind of stuff is not done for other drugs. There's other prescription drugs that are more dangerous. Antidepressants, for example. So why is it just being done for this drug? Thank you and good night.